With me today, Barnstable County, Sean O'Brien, who is the Director of the Health and Environmental Department at the county. You oversee an enormous amount of, I guess, divisions, we'll call them, within the county that deal with health and environment. Welcome.
Thank you very much, Paul. I appreciate being here. This is fantastic.
So we're going to try once a month to kind of do a little spotlight on some of the departments that offer services to every town on Cape Cod. And it's through the county. So the town of Barnstable partakes of those services on occasion. And so today what we really want to do is kind of give residents a feel for what the health and environment department does of the county. So let's give us the high level spiel first, and then we'll break it down into some minute detail.
Fantastic. Well, the first thing to say is we have actually been around for a long time. I have not been the director since 1926, but the department has been around since 1926. And our goal is really to support the 15 towns in Barnstable County. And a lot of times what we do is we take on a role that supports those 15 communities that we have. And we do things that may be best done on a regional level, or maybe more supportive of towns where they're unable to do it. And that's really what we've seen our role become. So we work hard. We've got a staff of about 32 people. In the summertime, it grows up to about 40. And we have a lot of great divisions and some really dedicated people that are a part of our different programs out there. So, you know, primarily when you look at our department, and we're based in Barnstable Village, we actually are in the old jail. And when you look at our program, we have a lot of different divisions that do different work in the health and environmental field. We have a septic system loan program. We have a public health nurse who works with vaccinations, disease follow-up. She works with Lyme and tick-borne illnesses as well. We have a Barnstable County the Barnstable County Water Analysis Laboratory, which is 10 very dedicated people that work on conducting water analysis, whether it be drinking water, whether it be surface water, whether it be water around a waste site, or something like that, and they do quite a bit of work for us. We have an environmental division that takes on quite a number of tasks, whether it be from septic inspections and septic plan review, all the way to restaurant inspections. But we also do things like hoarding. We assist with rabies and rabies monitoring and rabies baiting in the spring and fall. We have some septic loan, a septic system test center based out of the department that looks at all of the alternative technologies that may be out there. We have a tobacco program, and that individual, Bob Collette, who you've probably had on here before, has done a wonderful job making sure that the towns on Cape are in compliance with the tobacco regulations and really working with trying to prevent underage smoking. So we have a really wide range of things that we do. And we just, our goal is to make sure that these things are accessible to the citizens in the towns in Barnstable County.
It seems such a wide array of things that may look disjointed from an outside view, but when you talk about health and environment, literally hand in hand, right?
Really hand in hand.
All of these things go together. So let's break some of these down a little bit. I'm going to start, because it's Emergency Preparedness Week, I'm going to start with your emergency management and your medical reserve corps. Start with the emergency management.
Sure. With emergency management, we actually started to work on emergency preparedness back in 2002 at the request of the fire chiefs and the police chiefs of Barnstable County. So what we did was we formed an organization called the Barnstable County Regional Emergency Planning Committee. Originally, the purpose of the committee was to be a hazmat committee, to make sure that all 15 towns were in compliance with federal hazmat regulations. And we have a person that, Amy Alati, who does a fantastic job making sure that all folks that have large amounts of hazardous materials report those to the towns and to us every year. But as it grew, we realized we had emergency preparedness people from all 15 towns meeting in the room at the same time. why not start to look at discussing other things? And that's when we started to get involved a little bit more with emergency preparedness. And we started to see more when it came to storm response. So we've developed a regional sheltering plan. During every storm event that needs sheltering, we open up a multi-agency coordination center, and we coordinate resources, power restoration, and sheltering through that MAC. Sometimes the sheltering doesn't need to open, and we still open that MAC to support the communities. And then we have this wonderful organization called the Medical Reserve Corps. And we're always looking for volunteers. I always try to advertise a little bit for that group. But the Medical Reserve Corps actually supports the medical response within our shelters.
Okay.
But what it also does is it provides support should there ever be a public health emergency. And so back in, just going back in a little bit of recent history, we dealt with an increase. I don't want to say it was a flu pandemic, but we saw increased cases of flu across Barnstable County. And what we did was we used our Medical Reserve Corps to go out and assist with all of these flu vaccinations across the county, and it saved thousands of dollars for the town. For the different towns when it came to that response. And that's what they're there for. They're there to support our public health infrastructure in times of emergency and need.
That just seems so far-reaching, when you look at emergency preparedness, and we've been talking about it all month since Governor Baker declared this month as the month to talk about it. The planning piece of it is really, really important.
Really. Mm-hmm.
So that's fantastic. Then a little bit, the laboratory. So, we don't talk, well, we are starting to talk about the wastewater quality and quality of water. The laboratory and the beach analysis and the water analysis that the county provides is such a service to the towns because labs are expensive.
They are.
So tell us a little bit about that program. Collection of just water from everywhere, or?
Well, we have a wide range of things that the laboratory does. So first and foremost, we provide a service to the water departments here in Barnstable County. We provide analysis, whether it be microbial, whether it be chemical analysis, to make sure all of our drinking waters are safe. And we extend that off to folks that may have private wells. So in areas like where we may see more private wells, like on the Outer Cape or West Barnstable or areas like that, there is a place they can go and get some testing done, and it's actually a pretty good rate. It's a subsidized rate. It's a government laboratory. That's something that we're able to do. Since I've taken over as director of the department, we've also seen quite a bit of an increase in actually the amount of wastewater testing that we do. Because we have an alternative septic system test center, we're constantly looking at the data of these alternative septics. We're trying to measure how the performance is. How good are they at nitrogen removal? And so we see a lot of these samples coming into the department and coming into the laboratory, and we do really well and analyze them and get that data out there. We're starting to ramp up for a newer project, and it's actually an old project that's just kind of been refurbished, so to speak, and that is the MS4 program, which is going to be stormwater monitoring.
Okay.
A lot of that analysis will come through our department as well. The laboratory also provides a huge service, especially in the summertime, and that is a beach sampling program. The beach sampling program, the folks there have done a wonderful job making sure that every beach in Barnstable County, whether it be public or semi-public, is analyzed for bacteria. We want to make sure that when folks are down here and people are able to come in, or at the beach, they're going into safe water that's clean. And folks can always check on our website at barnstablecounty.org. You can find the department through there. You can always check the water quality that's out there.
That's great. We know that some of our ponds, especially after a high rain incident, or even some of our beaches, those bacteria levels will rise as the storm water, comes into the bays and ponds and stuff.
And this was a tough summer. We saw a few more closures. We had some really hot and humid weather and a little bit of rain, so it did create some issues.
Right. The septic piece of this, so we've talked a little bit about the new testing, which I think is fantastic, that, you know, finding ways to reduce nitrogen before it hits the ground. We have to remove it, obviously, that's already there, but reducing it. But also that failed septic systems, you know, when that is happening to a homeowner, it's a huge expense. Talk just a little bit about the loan.
Yeah, we have one thing that's really worked out very nicely, and we actually hit a benchmark this year with this program. So we have a septic loan program through the department, and the staff there are fantastic at helping citizens get a loan in order to replace their septic system. It is there for failed septic systems, and it's got a very high approval rating, getting people approved for loans and everything. And what it does is it provides you that soup to nuts. So septic plan design, maybe you know, the installation, and then the lot restoration afterwards in order to put a new septic system in. And it's really, so we hit a nice milestone. We actually this year made we were up to $40 million of loans out to the citizens of Barnstable County. And we offer this program to all 15 towns. We have installers, engineers, homeowners who've worked with this program since the beginning in the early 2000s. They've done just such a wonderful job. And we look at this and we say, this is just such an important environmental program. It's not just a loan program, it's an environmental program where it takes those systems out of circulation, for lack of a better term. It takes them out of play, and it allows us to get a newer Title V system in that does better treatment.
Right. And that kind of leads me to one of the last departments that we'll talk about. It seems very broad. It's the environmental department. Well, sure. Well, what does that mean, Sean?
So and it's great because
it's everything's the environment. So
we have some dedicated staff in our environmental department, and we do a wide range of things. A lot of it can be assistance to the communities, assistance to the boards of health. When it comes to doing septic plan review, Title V, final septic inspections, test holes, restaurant inspections. But then also these staff folks have different programs that they work on as well. So we assist the communities with hoarding. And we've developed a hoarding task force. It's been, Erica Woods has done a wonderful job bringing folks together to talk about such a serious public safety issue, because, you know, it can really put folks in danger, and it needs to be addressed. We have a fantastic landfill monitoring program. Most landfills are closed. If you look, there's a lot of solar panels on landfills on top of that clay cover. But there's still groundwater that flows underneath them. And we actually still check the water quality for about 11 communities in Barnstable County to make sure that, you know, water quality is good. And we collect those samples. We still have a rabies program. We assist the United States Department of Agriculture and the Commonwealth of Massachusetts with distributing rabies baits. So, and it's a way for us to try to keep Barnstable County rabies free, which we were for a long time because of this program. So it's an incredible division because they're very diversified and they work on very, very different things. And the staff is really there to serve the 15 communities. And they're there to actually assist us when we bring our summer staff in every year too, to collect beach samples, to collect, to go out and do restaurant inspections, swimming pool inspections, and all of that, and they're fantastic.
What a great department.
I'm a lucky person. I have a great staff.
You have a great staff.
Yep.
What do you want residents of the town of Barnstable to know about your department and the services at Barnstable County?
I think what's great is, you know, we offer a lot. So for the folks in the town of Barnstable and any other town in Barnstable County, you know, look at our website. Look to see the services that we offer and see if these are things that can help you out. You know, we've got folks with experience in indoor air quality. We have folks with experience with Title V. We have folks with experience in hoarding, or somebody that can assist with your question regarding septic systems. I mean, it's important to talk to your town about your current septic system, but if you're looking at an alternative, talk to our department. We can assist you with that. Or you can talk to your town board of health too. But we have some pretty good and up-to-date information. And look at the different services that we have, and any questions that you have, please reach out to us. We want folks to know what we do, because it's really, and I think a lot of people do. But we sometimes we do so much work and we forget to make sure to show people what we're doing. And so opportunities like this to come in and explain what our department does is really important. And I think anytime anybody hits our website, it's a great thing for us.
That's great. So we're going to start having somebody from your department once a month here on the show highlighting what they do, so our residents can utilize the resources that are out there for them.
That'd be fantastic, and we're there. Please stop by, and hey, maybe future show, come on in, we'll give you a tour of the lab.
Excellent.
Excellent.
Thanks so much.
Very good. Thank you
Thanks,
very
John.
much.